We'll get going so we have plenty of time. So I just want to welcome everybody. This has been such a busy week, and we are so grateful and happy to have Commissioner Jane Ryder with us today. I can imagine what an incredibly chaotic time it's been. I know it probably the last, what has it been, 3 years as commissioner, or 2.5 to 3 or something. And I bet the chaos of those last few years somewhat pales in comparison to the last 3 months. But we do appreciate, the way you've worked with our community and the way you're getting us through this crisis as well. So I wanted to actually just, well, I'd like to change my slide. Here we go. I just wanted to quickly go over kind of all the things that have been happening this week with guidance coming out from you, from DESE. We got some nice hospital visitor guidance that people may not know about yet. And there's also been some EI guidance. So when we wrap up at the end, if there's any time, we can go over these, but when you do get the PowerPoint, we will give you links to all of these guidances, and I'm sure the commissioner will fill you in on any details today. And the only other thing I wanted to say was next week, we have a really special guest as well. Her name is Nancy Luvago, and she is an executive director of Family Voices in Connecticut. And she's going to walk us through a lot of her expertise around intersectionality. So definitely, please try to join us for that. And I guess I will let the commissioner take it from here, because I want to give her some time to answer your questions as well. So thanks again so much, Commissioner.
Well, thank you, Mara. I really appreciate the invitation to join.
Okay.
And if everybody can mute for now, that would be great.
Again, I just want to thank Mara for inviting us to join you today. Joining me is the DDS Chief of Staff, Chris Thompson. It's really important for us to hear your comments, your questions, and to provide you folks as much feedback as we can. As Mara said, well, first of all, it's only been just a little over 2 years that I'm in my position. It's flown by. But again, I want to thank Mara. I want to thank Leo and the ARC. Your advocacy is so important to what DDS does. And again, I really enjoy, my whole team loves working with all of you. And it's important for us to be available to you and to be available to answer questions. We might not have all the answers, but we will get back to you and stay in touch with you. So as Mara said, this has been an incredible 3 months, and I first want to thank everybody. I know it's been hard on everyone, not only all of you folks and your sons and daughters and brothers and sisters. It's been hard, and I understand that. And the good news is things are getting better. Like most of you, I watch the governor every day as he reports out his numbers, and I think it's because of the work all of you have done and everyone throughout the state of Massachusetts. We're seeing the numbers go down, and that is such a good sign. And as the numbers go down, and as the governor is starting to reopen a lot of parts of Massachusetts, DDS is also. A lot of people don't think we're doing quick enough. Some people were thinking we're doing it too quick. But I just want to remind everybody, we are being very, very cautious. The safety of your sons and daughters and brothers and sisters, and the safety of you and the safety of our staff. We're all taking those things into consideration, and we just want to do the right thing. People have done an amazing job as far as really paying attention to hygiene, to wearing masks, to respecting social distance. And those are the things that have made a difference. And we've seen the numbers go down. And I think, as the governor talks about all the time, he's constantly looking at those numbers, and he's being very cautious and slow. And if for any reason we start to see the numbers go up again, he will change course. And I'm very, very concerned. Again, I think Massachusetts is a leader in the sense of combating this virus. But you look around the country, and I think some states that opened up things early are not respecting all the guidelines that were put in place. You're seeing the numbers of positive cases and unfortunately deaths go up again. And it's very, very concerning. So we appreciate everybody's patience. I think that's been the main thing to thank you all for. As Morris said, we've released our visitation policy, an outdoor visitation policy. I want to remind folks that is just the first step. And as I said, we're gradually opening things up. I know it's difficult. I know people haven't seen each other in 3 months, and it's hard to think that you can't hug your child or kiss your child. And again, I appreciate everybody's patience. And again, this is a first step. We're just being very, very careful, and things will get better. And I think we're just all getting into really good habits about wearing masks, being very, very aware of distancing and respectful of each other. And we just don't want to see any type of outbreak of this virus within the DDS system. So the visitation policy is just the first step. The next thing I know everybody wants to talk about is the reopening of day services, which is a huge part of what we do to support people. And again, we're working very hard on doing it the right way and doing it very cautiously and just making sure everything's in place as we open up services. So we're working with our providers of day services to make sure all those infectious control policies and guidance and procedures are in place in all of their buildings, that all staff are receiving proper training, that all sites, all vehicles, everything have cleaning protocols, again, just to be aware of all these issues. And once again, we're going to be doing this gradually. I hope people don't think, July 1st, all of a sudden the doors are going to open up to our CBDS programs or our supportive employment programs. We're going to do this very carefully and very thoughtfully and do it the right way. And I know this has been a long time. It's a long time I know folks who have been having their sons and daughters and brothers and sisters living with them. I know a lot of the people we support who live in group residences. I mean, they've been housebound, and that's been difficult. And I hear a lot from families. I hear a lot of the struggles people are going through, and we're doing our best, and it will get better. But I just want to say again, I appreciate everybody's patience. We're going to do this carefully, cautiously, the right way. So for any reason, we're not going to go backwards. We're just going to go forward and keep on opening up and hopefully getting back to some sort of semblance of normalcy in all of our lives. And again, it's very important for us, for Chris and I, to hear your questions and comments. But Chris, before we get started, is there anything you would like to say? And I want to make sure you introduce yourself and people know who you are.
Hi, Chris Thompson. I have a little echo here going. Thank you, Commissioner, and thank you, Maura, for having us on. It's good to talk to you all here, but I actually don't want to say anything more. I'm here to listen and to take your feedback in considerations and questions back to the policies that we write and the protocols that we put together. We work very closely with the Executive Office of Health and Human Services, and we're just one, DDS is a big and important, but one piece of the human services system, of the congregate care system. So you'll notice that, our visitation policy and guidance looks exactly like the Department of Mental Health. And it looks, and we haven't even started visitation with Department of Children and Families and Youth Services yet. So we work very hard to make your voices heard and to make considerations for DDS a part of the policies we put out. So thank you for that feedback, and I'll just listen, and thanks for having us on.
Thank you so much, Chris. I just want to preface before we go into the questions that I've been hearing from families this past week or so, and really throughout this turmoil, emotions are so mixed and high and low, and some people are feeling a lot of fear still, like you said, and some are really in a very hopeful state. But they're definitely frustrated, mixed emotions. And so I think you'll hear that coming through some of the questions. And I don't know, I see like absolutely one of the first questions, I really want to talk about the visitation guidance. But one thing we didn't mention yet was testing, which seems to be coming up quite a bit for families around staff. So I don't know if you guys have something you can add about that now.
It would help if I got off mute. We have done a concerted effort to get both the individuals we support and the staff that work with them tested. EHS entered into an agreement with Fallon, who has been available to us to do mobile testing. In addition to that, we've been working with a lot of our providers and state staff to do what we call pop-up tests, where Fallon sets up a site where people can go and get tested at different parts of the day. And Chris, I'm sorry, you know the numbers better than I, as far as the number of people we've tested since we started. I think, was it in the beginning of April or mid-April?
Yeah, we started with Fallon on April 10th in the other, and so I'll just talk about the Fallon testing, and it's, we say Fallon, but they do a fair amount of subcontracting also. So there are other ambulance companies and EMT, EMS services that are part of their team. But we work with Fallon to organize all of it, and they've been great partners to us. But I'm just looking away from you all to my screen so that I can just read the numbers. But we have done 19,000 tests with Fallon, 6,800 around of residents in our group homes, both facilities, provider-operated homes and state-operated homes, and over 12,000 staff. We have done 6,000 staff tests at our pop-ups, and we've done more than 30 pop-ups across the state. So we know that is not enough, and that there are more people that need to be tested. And we're going to continue to advocate for the Fallon testing, which is important to note, is free to the residents and to the staff being tested. They pay nothing out of pocket for these tests. It's all being covered through Mass Health. So we're going to continue to advocate for the mobile testing and pop-up testing to be available, and we've really pushed to make the access there for staff and for residents, so that they can get tested. And if there are instances where we've done retesting by request for individuals who've tested negative in the past to be tested again in the event that they could have been exposed to the virus again. So that's happened too.
And I've heard from a lot of families, I hope folks know that they don't understand why we don't do mandatory testing, that we don't mandate it for all staff across all shifts to be tested. Right now, as Chris said, we're strongly encouraging and working with not only our state-operated homes, but our provider homes to make that testing available to folks. And again, I know we'll have difficulty, especially our third shift staff being available for the test. But the testing is, and as Chris said, we're continuing to advocate for more testing, and because it really is the way to to track this virus and to make sure we're ahead of it. However, it's just one piece of all the things we need to do to control this. So we're continuing to monitor staff as far as any symptoms, and we're very strict about staff wearing masks and the cleanliness of the homes and people being vigilant about all those things. So testing is one piece of a great deal of things that we're doing to stop the virus, and all those other things as far as monitoring the symptoms of both the individuals we support and staff, monitoring systems, making sure that no one is coming to work when they're sick, and when they're at work, they're practicing very, very good cleaning routines and personal hygiene and wearing masks. And we're on top of that. And it's hard because I think people, because things are going so well and because the weather's getting better, people are getting a little lax. And we're doing our best, making sure that all those good practices that we've established in the past 3 months don't get ignored and don't fall by the wayside. So testing is key, and we're continuing to work with the folks at the Executive Office of Health and Human Services to provide more opportunities to get tested. And we're just trying to stay in front of, I think folks know, it's almost like the guidance regarding this virus changes constantly. We're always in touch with the CDC and the Department of Public Health on the things that we should be doing and the ways of doing the right thing as far as controlling this virus. So we're working very closely with our partners at the Department of Public Health and CDC to make sure people have the right information, and we're doing what we have to do to control this virus.
Thanks, Commissioner. I'm going to let Carrie look at the specific questions, but I know that testing in general is relating a lot back to the visitation guidelines, where families are feeling like if the staff is not being tested, and we know there's such a high rate of asymptomatic carriers, yet as family members, we're still kept so far and so distant, which really precludes many of the families from visiting. Is that something that we're working on in terms of sort of the inequity there?
Yes, and I'm sorry, Mara, what did you say as far as, could you, I'm going to close my window. People are having their lawn done next door, so.
I'll move closer to my mic.
Can I ask a question? How do I submit a question?
Oh, right at the bottom of your screen. Is that Paul?
Yes.
There should be a button that says chat, a little. And,
Oh,
and
yes.
you click right on that and you can put it into everyone.
Thank you very much.
You're welcome.
Yeah, and what we can do too is, I mean, we have lots of questions for you. If we don't have time to get to them all, we would love to share our chat box with you.
Yeah.
And so you would be able to view them that way as well. So just, you know, Maura is correct. I mean, a lot of concerns about the inequity of staff not, you know, being able to visit and, you know, work their shifts and families not. Also, there is a lot of questions about people really want to take their kids home. And so when, do you have any idea what window that would look like?
That, I'm off mute now, right? Yes, that is the next step. And that's exactly what we're planning for right now. There are many families that do want to take their sons and daughters, brothers and sisters home. There's also a group of parents that I know have taken their kids home during the last 3 months, and that now they're ready to bring them back to the group homes. So that's the guidance that we're currently making sure that we are, again, taking all those things into consideration. As I said, this outdoor visitation was the first step. And you're absolutely right. The next step is again, allowing families to take their loved ones home and bring their loved ones back to maybe their residence. So you'll be hearing about those next steps very shortly.
Okay, great. Thank you. And then Diane had a question about do the ABI and Money Falls a Person homes follow the same DDS guidelines for staff and resident testing?
Yes.
Okay. And then Kathy has a question. If all individuals in a house have had COVID, shouldn't it be possible for family to visit with fewer limitations?
As I said, as we're gathering more information, that's an excellent question. And Chris, I think you've been having those type of discussions with our infectious disease control experts that we've been working with.
Yeah, and I'll just add that, you know, in the visitation guidance, we say very clearly that this guidance is in place not only to protect your loved ones and keep them safe, but also to keep visitors safe and to keep staff safe. And so I think that, you know, it's sort of a three-way protection. And so we still want to be cautious if, you know, staff is there, that, you know, we're keeping them safe, or that, you know, visitors are not, you know, getting exposed to the virus as well. So that is an interesting point, and one I will take back for review. But that's just our approach on all this stuff, is we would just want to make sure that, you know, everybody on site, you know, is being kept safe by the policies we put in place.
Okay, thank you, Chris and Jane. So Jane remarks that testing has not been repeated in both the provider and by the staff and the individual that was that contracted it. So there was just no symptoms and that sort of thing. It just seems like retesting isn't happening as frequently. And just, can you speak a little bit about that? There was a couple of questions about people being retested.
And I hate to keep on Chris thought he was going to be listening, not talking, but Chris is, whether he liked it or not, has turned into kind of a testing czar for DDS. He works very closely with Fallon and the folks at EHS in rolling out this initiative. And I think you shared, Chris, as far as retesting, right now it's been as people have requested it.
Right. And so a few weeks ago now, which feels like a very long time ago, I think the CDC put out guidance around what they call a symptoms-based recovery strategy, and there's specific guidance around when someone should be retested. And so we are, when it's requested, retesting folks who have tested negative in the past if they're either showing symptoms or have likely been exposed to someone who may have it. The science just isn't there around people who've tested positive in the past, retesting them. So I think that there's much more confusion on that side of things. And as a rule, following DPH and CDC guidance, we have not been retesting people who have tested positive in the past. Yeah, so I guess, does that answer the question around retesting? It's being made available when it's requested.
I would jump in there, Chris, just to say, I think we are all, you know, focused on the need for mandatory testing, but we also know that the test that's done on a Friday and comes back negative could be positive if they do it again on Wednesday. So is there any look to like do any kind of standardized retesting, or, you know, every 2 weeks, or is logistically that something that's even being thought about?
And that's a great point, Mara. And actually, there are discussions happening at the executive office and DPH around doing some type of regular testing. As you just said, logistically, we haven't figured that out yet. We have over 2,000 group homes, 2 facilities. All I can say is it's being discussed and people understand what an important step that would be. But to figure out actually how that's done across the entire state with the number of sites we have is something needs some thought. Anything to add to that, Chris?
No, just that we are, again, I'll say that the decisions around things like this are made. We are a big, important piece. But the policy that was made there would apply to DMH and other agencies as well. And we're certainly looking at nursing homes and have gotten adopted a lot of the policies being used in long-term care facilities. So yeah, we're actively having that conversation now.
Great.
Okay, thank you. It's just, let's see, a few questions about transition. So, family members that are turning 22 during this COVID time, and any thoughts about that? Any, what plans that DDS is doing?
We're continuing to work with the folks who are entering our system as they're turning 22. Our turning 22 transition coordinators in our area offices have been in touch with families and individuals as far as the next steps. It's just, as you can imagine, as far as the day program's not being opened yet and what we can offer families, there's been, this is just part of the process. But we are making sure they're aware of our family support systems in place, things we can do to help support these families coming into DDS for the first time. Just really maintaining communication right now, I think, is the key to the whole thing, to make sure that families know we are here, keeping them updated on, as our services start to reopen, how that will affect their sons and daughters. So we continue to stay in touch and be in communication with people and offer whatever we can until day programs are up and running.
Okay, thank you. A few more questions about when day supports open up and when a son goes back to a group home, will they need to be tested before they go back with documentation?
That's part of the discussions we're having right now, because most of the folks going back into day services are at home right now, their parents' home, so they probably aren't tested. So that's part of our reopening discussion. And the same thing with the folks who have been, their parents have taken them home. So that'll be part of the guidance that we develop as far as the testing requirements for folks entering back into services.
Okay, so, and then just a couple of other discussions going on in chat about, if, that the community is opening up, restaurants and that sort of thing. And so people kind of wondering the difference between, people being able to go out for dinner somewhere, but, not meeting a parent for a visit. So
Right.
If you could just talk about, some of the thoughts around that.
Right, and those are the type of questions I've been hearing a lot too, but you also notice the steps of even reopening some of those services. So for example, restaurants right now is just outdoor dining. And that, you can imagine the effect that's having on restaurants, but it's the first step. I finally got an opportunity to get my hair cut the other day, and the place I go to, the measures that they had to put in place to safely get a haircut were pretty unbelievable. As far as, I had to wait in my car, I had to be texted into the salon. There was limited number of people, stylists. There were the plastic barriers everywhere. Everybody had the mask on. I had to wear the mask on. Those are the type of things we have to put in place for our day programs now. So yes, there are things opening up, but you can see even those things opening have very strict guidelines, almost similar to our outdoor visitation guidelines. But as the governor says, this is, we're eventually going to be able to go back to restaurants, inside restaurants, but we're not there yet. And it's the same thing with our visitation guidance. This is the first step. It's not perfect. It's not going to be forever, but it's just it's so important, I know, for you to see your kids and for your kids to see you, and we want to make that happen. But again, it's not going to be forever, and it's not going to be permanent. We're just going to keep on monitoring to make sure, again, we're doing this the right way and making sure everybody's safe.
And
Yeah. Do you
Carrie,
have any idea? Oh, I'm sorry. Go ahead, Mara.
Sorry, I just wanted to jump in to say that we also understand and take into consideration that our population is more vulnerable, but it's kind of a catch-22 because parents feel like they know their kids best. They need their eyes on them to see if any health issues are coming up. They take them home frequently for that reason alone. So the fear of health in general is definitely in all of us. And also, so many of our kids don't go 3 months without regular checkups, whether it's dental or primary care. And some of the telehealth might work, but some of it just doesn't. So I think anxiety is building around their overall health as well. And even like my son was home with me, but he couldn't go to the dentist. And so now he went back to his residential and there's no plan for dentist.
Right.
So I'm thinking, how long is it going to be?
Right.
So yeah, it's good to hear that things should be moving progressively, maybe quicker than they have in the last 3 months.
Right. And again, this is, I hope people don't think I'm being defensive or making excuses. I mean, this was a situation that nobody planned for. And I think people are trying to do their best. For example, dental services. I don't know if many folks utilize the Tufts Dental Clinic that we have across the state. There's one at Hogan, there's one at Rentham. We have to make even some very dramatic physical changes to those sites to make sure like the air is circulated correctly and everything is hygienic. And it's I'm sure every dentist office in the state has to meet new requirements just in response to this situation. And you're right, it hasn't been perfect. I know people have been trying to not only do telehealth while they've been in their group homes, but also trying to communicate with their family members through FaceTime or Zoom or anything. But I hope you know, I mean, a lot of your kids, they don't understand what's going on. And if they don't see you or can be able to touch you, it's hard to explain to them why they haven't seen their mother and father in 3 months face to face. Why haven't I gone home with my parents? And I mean, all of us are having a hard time kind of grappling with this virus, but folks with intellectual and developmental disabilities, you talk about their physical health. I'm also concerned about their mental health. Like, how are they reacting to this situation over the past 3 months? I know staff in group homes have been doing everything possible to try to, again, keep them engaged, to reassure them that everything is going to be all right. But not seeing your parents for 3 months and not being able to touch them is heartbreaking. It's impossible to be able to explain to folks, and it's certainly not the way any of us want our world to be. But we're as I said, it's going to get better, and we need your help. We need your patience. We certainly hear from all of you, and that's why being part of this is so important for Chris and I, because as Chris said, people think because we're the Department of Developmental Services, we can do whatever we want. Unfortunately, we work in a bigger system at the Executive Office of Health and Human Services. And I can see from, some of the chats going on, people want to know when. When are you going to be able to do this? When are you going to be able to tell us this? And that it's been hard because we have to run everything through our colleagues at whether it's the Department of Public Health or the Executive Office of Health and Human Services. And the governor wants to know these things. The governor wants to make sure that, DDS isn't just like going out and doing everything that he doesn't want, not only us to do, the nursing homes or the hospitals or the assisted living units. I mean, my heart broke during, the last 3 months when I listened to the governor. He talked about not being able to see his 92-year-old father. So, it affects him personally, but he's trying to do, we're all trying to do whatever we can to control and stop the virus so we can go back to some type of normalcy. So the best we can do is just keep on talking to you folks, giving you as much information as we can, and listening to you. And we're committed to doing that.
Okay, thank you. Just a couple of also questions about reopening of day programs. Can you give like a sketch of the phases or what people are thinking?
What we're thinking right now is, again, to make sure we have to put very strong infectious control processes in place at the day programs. And they've been closed since, I don't have to tell you folks, since mid-March. They have to make sure that their physical sites are going to be safe and that their staff are trained in all forms of infection control, good hygiene. All the physical sites meet the standards as far as being cleaned on a regular basis, that the bathrooms, that enough cleaning supplies are available to people, that there's enough PPE, that when everyone's back, staff and individuals, there's enough PPE to keep people safe. And we're right now talking with our providers that run day programs to, as again, we're just not going to open the door. There's going to be a gradual process of what's the safe number of people that can be in a building at once. You've heard the governor do this for all offices, that we're starting out with like 25% of the people that can come back to work and be in an office at one time. It's kind of like you got to do it gradually. You got to make sure that there's proper space in between people, that again, that everybody has hand sanitizer and proper cleaning supplies in the bathroom, and there's enough space so people can keep that 6 feet of social distancing among people. So the day programs is also going to be a kind of a gradual a rollout. And again, it has to be that way to make sure everybody's okay.
Thank you, Commissioner.
Okay, thank you.
I know that we need to wrap up your time. And I just want to thank you. I know you know the uniqueness of our population, and that's what we need you to communicate back to HHS, because these other agencies don't have necessarily the same set of situations. Especially, we're hearing a lot about behaviors and how the visits are going to affect behaviors, how the return is going to affect behavior, and as you heard, just a lot of medical complexity as well on top of all of that. So we so appreciate that insight that you have, that you can communicate on.
And I'd like to take Carrie up on her offer. I know we weren't able to address everybody's questions or concerns, but if any information, Carrie, you can share with us, Chris and I can bring that back to our leadership team. Maura and Carrie would be glad to, again, anything specific that we can respond to, we will as soon as possible. And, again, anytime we can come back and listen to folks, we're more than willing to do that. But
I don't know, my name is on the thing and I never got into anything.
Oh. All right, well,
Okay.
thank you again
thank
for your
you.
time. We will get these questions to you, and there are a lot of them, so.
Great. And we'll get information back to you, Maura and Carrie, that you can share with the group also.
Okay, good luck, both of you, and thank you again.
Thank you all very much. I appreciate it.
Okay,
Thank you.
everybody stay on if you want to hear some more updates from Ellen, and we'll wrap up in like 10 more minutes. So, okay, I'm going to go back to our PowerPoint, and I'll get you guys. So we will get those questions out to DDS, and I just really had a slide just reminding people that the budget is actually becoming the highest priority to the ARC at this point. As some of you know, we were maintaining our budget that came out in January with the idea that we had a $60 million set aside for the workforce. And we really just don't know what's happening with the budget at this point, given the revenue has plummeted. So stay tuned. I won't spend too much time on that, and I will turn things over to Ellen.
Sure, and I can be quick as well if there are additional questions that you want to ask Maura, Carrie, and I. But we just wanted to let you know that there are a lot of updates on June 9th. So the U.S. Department of Health and Human Services announced that they're doing a next round of funding for the Provider Relief Fund. So there are $15 billion to eligible providers that participate in state Medicaid and children's health insurance program providers. So we wanted to let everyone know about that. And then also on June 9th, and I believe Maura referenced this earlier, but the HHS Office for Civil Rights announced a resolution that made clear that federal law requires that hospitals and the state agencies that oversee them to modify policies to ensure that patients with disabilities can safely access in-person supports that they need to benefit from medical care during COVID. So that's a really important development. So we want to let you all know. And there's a link there that provides the HHS announcement. And then, of course, just to remind you that we're still continuing to push the Senate on the HEROES Act, and we're so proud of all the advocacy that everyone's been doing as a part of our We Are Essential campaign, and to remind everyone that we have the story collection tool to collect and share stories to send to your members of Congress, and then we have our tweets and messages templates for the We Are Essential campaign, and of course our action alerts to call and email and tweet your senators. And things are moving a little bit in the Senate, and so it's really important that we're doing our outreach. And then of course for the census, we have a Census Day of Action on June 17th. I wanted to let everyone know we'll be sending out information and again, sample messages and tweets that you can be doing on social media. And then we are also going to be doing a text banking system to send out the word and how important the census is to the disability community. So we're asking for volunteers to participate, and we'll have more information next week on the date of that text banking. But if you're interested, please email me and let me know, or you can email our census@arcmass.org email. But we are a census questionnaire assistance center, so please, if you have questions about the census, please reach out to us. And that's all for me, I think. We can open it up again to questions.
Yeah. Got a few more minutes.
Hey, yeah, so that we do have, Ellen, a couple questions in the chat.
Okay.
Let me pull them up. Okay. Lucy was wondering, will there be ARC advocacy on using federal COVID money coming into cities and towns are used for people with special needs?
Could you be a little bit more specific about that? I mean, we're certainly doing a lot of federal advocacy around, assisting people, supporting people with disabilities. And that's a huge part of what we've been advocating around the HEROES Act. So I guess I just need a little bit more information about what you're asking.
Okay, and then well, maybe Lucy's going to chat that in. Diane was wondering if her sister is home with her right now. She was from a group home. If we did census before our loved one came home, not counting them, and then they weren't counted in the group home, is this a do-over?
So they will be, so the group enumeration process was delayed because of COVID, but they will be counted in their group homes. So it's where people reside and live a majority of the year. So that April 1st deadline is sort of, it means some things if it's very complicated, if it's like, for instance, if it's a parent that has shared custody with their child and it's splits right down the middle. So where they're living on April 1st does matter, but for most, it's a majority of the year. So they will be counted in the group home. So you are correct in how you did it originally. But that's
Okay,
a great
thank you.
question.
And then,
We have been hearing that question before, so thank you for asking.
yeah, Lucy did come back in terms of advocating for COVID money to, especially for special education.
Oh, okay. Yes. Yes. And that is something we have Kathleen Amaral from the ARC that's been working a little bit closer on that issue. But yes, we have been doing advocacy around special education funding. So we're part of a, and I don't know if more if you want to jump in, but we're a part of a coalition that is working on that issue and looking at that issue at the state and federal level.
We're working on that on a state level as well. Certainly we had a bill that passed last year that was going to require huge investment in our education system. So that bill is trying to get sorted out right now, given we don't know really where that money is going to come from. And it included special ed as well. But we will be working certainly to get every single dollar from the feds that we can get here in Massachusetts.
Okay, thank you.
So Carrie, do you want to maybe also take a look at any questions that came in for us to answer, and we can get back to people as too, because I know there's just a lot coming in.
Right.
Yeah. Yeah, I mean, there was a lot, especially around testing and reopen and visitation. Yeah. And, you know, I think hopefully everyone feels like they had some level of their questions addressed. You know, people, you know, really want and need much more specific information. But as the commissioner did say, you know, that, I mean, they're working on it. It's, you know. So there isn't specific information, but yeah.
And Carrie, I will definitely take her up on coming back. Maybe next week we may actually have some DESE, maybe Jeff Riley from DESE, not during my webinar, but another time.
Great.
And because our Ellen and my webinar next week is going to have Nancy Luongo, but so either we'll have them the following week or sometime stay tuned, because we might have DESE, but then maybe the following week or the next week, it'll be time to have DDS back. And I think even Chris Thompson is a world of knowledge there for us. So we could try to squeeze him in too.
Yep. You know, another, I'm wondering more if you want to chat in the email for people to contact DDS directly.
I think it's,
or do we have that in a link somewhere?
It's on my PowerPoint at the last slide, so you're going to send that out.
Okay. Okay, great. So that will be
How
out.
do we get a hold of Jane?
Yeah, that will be, there is a link to, that will be shared in the PowerPoint.
Mm-hmm. I think actually we have a bunch of links in there, so you might have to cruise through and see which ones are important to you. But if there are questions that we're not getting to now, unrelated to the commissioner, we'll try to get back to those as well. So thank you, everybody. Thanks for your patience. It was a big group this week, so hard to get to everybody's questions. But I look forward to seeing you again, and stay well this week.
Thank you.
Thank you.
Thank you.
Thank you.
Buddy.
Say bye. Bye-bye.
Bye.
Bye.